My name is Daisy Baldwin, and today I'm going to be presenting on nursing students' perspectives on incivility in the clinical practice learning environment. And I'm part of a team with Peggy Hancock from Western Regional School of Nursing, Christine McDonald from University of Ottawa, Daphne Kennedy, also from Moran, Dr. Sandra McDonald from MUN Faculty of Nursing, Dr. Kathy Watkins from the Center for Nursing Studies, and then myself, faculty at MUN Faculty of Nursing. And next I just want to talk a little bit about what is currently known and what we found based on our literature review. We know that the effects of incivility on nursing students cause anxiety, emotional distress, medication errors, and the desire to leave the profession, and this is what the literature has told us. Baccalaureate nursing students are experiencing incivility in nursing academia and the clinical practice setting, including in hospitals and in the community settings, and current research suggests that nursing students who experience such workplace violence also report increased emotional distress, increased errors in patient care, and a desire to leave the nursing profession entirely, even though they haven't even really gotten to experience being a nurse yet. Now, next I'm going to talk about the definition of incivility. So there are a number out there, but it's a low-level deviant behavior that violates the social norms of mutual respect and courtesy. It's any speech or behavior that negatively affects the well-being of another individual. It can be psychological in nature, vague or ambiguous intent, inconsistent social conduct, subliminal, overt or covert, sarcasm, mocking, humiliating, negative tone of voice, ignoring the strength and identity of the person in the presence of their associates. So it's just a low level of deviant behavior. And one sad part about incivility is the fact that in many cases, the person who is being incivil to the other person probably doesn't even realize in some instances that they're doing it, or that it could be impacting the person in a negative way, as I just said, maybe even influencing their decision to leave the nursing profession altogether. So those examples, again, are just sarcastic talking, mocking, humiliating opinion, a negative tone of voice, and ignoring the strengths and identity of a person in the presence of associates. It can be what you say, but it can also be what you do. So in your eye contact and action. Okay. And the purpose of this study. So the purpose of this study was to explore nursing students' perceptions of incivility in the clinical practice learning environment. A little bit now about our study design and methods. So we used a survey and focus groups. So this was our original intent. It was going to be a mixed methods design, and we would integrate the results at the end. But what ended up happening is, and I'll get to that a little later on, is it ended up being more of a cross-sectional design that focused mainly on a survey, and that was due to some challenges that I'll outline a little later. Our sample were BN students from the collaborative program, 4-year option and fast track, 2nd, 3rd, and 4th year. So we didn't include the first years because the study did begin in the fall of 2019. And during that time, first-year nursing students wouldn't have had the opportunity to participate in clinical because they would have just started the program. Like I said, participants consisted of all nursing students who are currently enrolled full-time in the Bachelor of Nursing program in one Atlantic province, and that was here in Newfoundland and Labrador. Participants will have completed or be in the process of completing at least one clinical practice course. And based on a sample size of approximately 800 students, we hope to get about 260 participants. For recruitment, it was during the first 2 weeks of classes in the fall semester of 2019, and students were notified of the study by information email that was sent out, and that was outlined in our application to the HREB. Embedded in that email was a link to a survey and instructions on how to volunteer in the focus groups as well. And 1 week after the email was sent out, I went around with permission from faculty and I held a 5-minute information session during one class in each year of the program so that all nursing students and potential participants would receive the information. And during those sessions, students were given information about the study, instructed on how to access the online survey, and how to volunteer for the focus groups. And students were also given instructions to email myself if they wanted their names entered for a drop or $30 gift card. Here, and you won't be able to bring it up now just because it's been quite a while since we offered the survey, but this is just a little code, a QR code that we used, and all the students had to do when I went to give them the information on the study is we told them to just put your phone camera up to the code and the survey would become available to them. So it was a nice, quick, and easy option offered through the Hmong Qualtrics. And we were able to allow them to complete the surveys over their iPhone or whatever phone they had. It worked on all types. And we also developed this tool. It was adapted from the research questionnaire developed by Hewitt and the original Burke survey that had been used in Australia, New Zealand, the UK as well. So that's just what the students would have seen when we presented them with the survey. Recruitment challenges. So we came among many recruitment challenges, and mainly due to the fact that COVID-19 decided to come along, and as it posed challenges for everybody's lives, it also posed challenges for research. So with our recruitment strategy, so we got our approval, so that was fine, from the HREA, Morrison, Faculty of Nursing, Center of Nursing Studies. We sent out our invitation emails to the 3 sites and distributed them through Brightspace like I talked about. We had our information sessions. All that went pretty smoothly. We had some scheduling challenges, as we would, trying to get into classes where the greatest number of students would be, or where the class might have been mandatory, like, for example, labs, and it only took 5 minutes of the students' time to allow us to get in there with bigger class sizes and to speak to the students. We wanted to let them know that participation was completely voluntary. They could stop taking part of the study at any time without any explanation or prejudice. Faculty did not administer the surveys. Faculty did not lead the focus groups, and faculty did not know if they did or didn't participate in the study. And the focus group meetings happened to be our biggest challenge, and that was simply due to the fact that they were held in the winter of 2020, and that's when COVID-19 occurred. So when we started to do the focus groups, I think we had one lot of focus groups, and then we all went in lockdown. So we tried, and we got approval from ethics to go back and do online focus groups, and we tried to do online interviews, but it was a very stressful time, as we know, for everybody. So unfortunately, we didn't get enough participants to include the focus group, and we had to stick, instead of with a mixed methods design, more of just a survey cross-sectional design instead. Oh, demographics. So from the students who did participate, we did get 254 participants, and they were predominantly female, 91%. 94% were born in Canada, 53 or 17% were between the ages of 18 and 19, 217 or 70% were between the ages of 25 and 29 years of age. And if you want to look at a breakdown of the years of study, out of our second year 4-year option, we had 102 participants. From our third year 4-year option, we had 109 participants. From our 4-year 4-year option, we had 81 participants. And from our second year fast track option, we had 19. Remember, we would not have included the first year fast tracks because they wouldn't have had the clinical experience, or the first year students. And this was a little alarming. So based on the results of our study, we found that 70% of nursing students have experienced incivility in the clinical practice learning environment. So that's quite an alarming number. Based on these results, we found that 75% of the students stated that they experienced incivility within hospitals, 50% within long-term care, and 16% in the community setting. So while the numbers were quite different between hospitals, long-term care, and community, it does exist in all three areas that we send students to clinical. We also found that 64% were unsure if policies existed. So even though they may have experienced incivility, they weren't sure if there were policies around it or who they would go to, or would it be a situation where they would go to the associate dean or dean at the faculties of nursing, or would they go to a manager at Eastern Health? So this is something that students were very unsure of, and something to consider for future research and an interventional study. Common behaviors. So common behaviors that these students in particular experienced were rude gestures or nonverbal behaviors. So it could have just been an eye rolling, for example, but in the context of how it happened. Disinterest in student learning. So they're like, I don't even know why I'm doing this. And in doing the few focus groups that I did, I wish we could have included some of the information that we found, because it was very interesting to listen to the students' feelings and comments, and I guess how they felt in that moment, and reluctance to answer questions. Common reactions and feelings. So they often avoid communicating. So when it happens, silence, don't really communicate back with the person who's being incivil to the student, afraid to ask questions, experiencing quite a bit of anxiety and embarrassment, and feeling ignored. So these were the common reactions that students felt when experiencing incivility in clinical practice. Strategies. So strategies could be to increase awareness of existing policies, because this is certainly something that the students revealed, like if they are, and especially looking at their actions, so that they're being silent, not knowing how to communicate, feeling anxiety. As nurses, we know that we need to be able to talk to somebody. We need to know where to go, and since this was certainly a gap found in the findings of this study, we should increase awareness on existing policies. And I know that Eastern Health is doing a wonderful job right now with promoting the fact that incivility is wrong, and that incivility should not be occurring in the clinical practice area. I'm sure many of you have seen posters all around the city hospitals. I know, because I work in the metro area, that they are all around the hospital, community center. So that is certainly nice to see. And to create a positive clinical learning environment. So they have certainly the potential, the findings, to inform and enable more focused support within the nursing curriculum to ensure the success of students and future graduates in managing incivility in their daily practice. And the results may enhance awareness by healthcare organizations, such that programs to improve the practice of nurses and other healthcare professionals regarding incivility towards nursing students is undertaken. Like I said, I see this certainly happening within Eastern Health, not geared toward nursing students as such, but as nurses as a whole. But certainly we should be taking students into account for this as well. And I'm sure the other health authorities will be interested in these findings, to be coming on board with these initiatives as well.